Adenomyosis Part 2. Let's talk about how to diagnose this problem. I'm Dr. Lucky Seacon, a double board certified OBGYN and REI, and if you watched my last video, Adenomyosis Part 1, we talked about what it actually is and some of the signs and symptoms associated with it. If you're experiencing pelvic pain, especially with your period, or you're having menorrhagia, very heavy periods where you're bleeding for more than 10 days at a time, you're soaking through more than a pad every 1 to 2 hours, or you're passing clots that are the size of a quarter or larger, these are all potential signs that you could have adenomyosis. If you're having bloating, or you're feeling like your uterus is bulky and enlarged, or your OBGYN told you this when they did your physical exam, these are all signs and symptoms that you could have adenomyosis. The first step to a diagnosis is doing imaging. The first step is pretty simple. It's getting a transvaginal ultrasound or a pelvic sonogram, and this allows us to get a side profile view of the uterus. You can see the cervix going all the way to the top of the uterine cavity. This is the inner lining of the uterus called the endometrium, and then you see this surrounding muscle wall that makes up the entire uterus. That's called the myometrium. Those yellow arrows are showing an area of focal adenomyosis, and you can see it demarcated with the green line here, and it looks asymmetrical. It looks very different than the normal surrounding myometrium on the other side. Now, you might be thinking to yourself, that seems kind of subtle and easy to miss. And that's actually very true. This is why it's often unrecognized or underdiagnosed. But there are other features that you can look for aside from the bulk or the asymmetry of the muscle of the uterus. Where you see that white star, you notice that there's this mottled appearance. So it's also this heterogeneous appearance to the muscle of the uterus that is a telltale sign. In some cases, especially with focal adenomyosis, it can be very confusing, and some people are fooled and think, hey, that looks like a fibroid. And so in cases where you're not really sure of the true diagnosis, or you see really subtle signs and you want to get a better view, a pelvic MRI is often the next best step. Again, this is a side profile view of the uterus. You can see the entryway and then the uterine cavity here. That green area marks the endometrium, and that red line is demarcating something we call the junctional zone. The junctional zone is the hormone-dependent zone, meaning it's affected by estrogen and progesterone, that represents where the endometrial layer and the myometrial layer meet. With adenomyosis, this tends to be bulky and thick, and over 12 millimeter thickness for the junctional zone is considered diagnostic for adenomyosis. Here's an example of a pelvic MRI showing a markedly thickened junctional zone, and so this makes the diagnosis really obvious. A common question I get asked is, do I need a laparoscopy? Do I need surgery to get a definitive diagnosis of adenomyosis? And the answer is no. It's really a combination of clinical signs and symptoms and getting imaging. But it should be noted that often the diagnosis is made after the fact, after someone has had a hysterectomy, or maybe they've had fibroids removed and the tissue was sent to the pathologist who cut it up into slices and looked at it under the microscope and was able to identify that there was adenomyosis where it looked like there was endometrial glands incarcerated in the myometrial muscle. So if you think you might have adenomyosis, now you can advocate for yourself to get the proper imaging and to get to a diagnosis. The first step to coming up with an effective treatment plan, whether you're treating symptoms like painful or heavy periods or infertility, is understanding what we're dealing with. Stay tuned for part 3 of my adenomyosis series dealing with how to treat.